Maverick Physical Therapy. Back to our little episodes on the thoracic spine matrix. We're going to be going after here in episode 2 a little type 1 in sync and out of sync. The nomenclature and everything we got into in episode 1 carried fairly significantly long, so it's good to start another episode here. Love the chaos. So we're going to go back to our what we call our LXX and RXX stance. Type 1 meaning rotation and side bend in opposite directions. For the purpose of this episode, we're going to preset with our rotation, and we're going to drive with our frontal plane or side bending motion. We'll drive with our side bending motion right here. And we will compare that to the other side as well, which we'll do in a second. But like type 2 in sync and out of sync in the first episode, when we're driving with our frontal plane reach overhead, we can also combine a little sagittal plane by not only reaching overhead and to the right, but kind of posterior lateral. So, boom, or a little more lateral. So we're preset with that rotation, we're reaching overhead to the right, and then behind us a little bit as well to take into account the sagittal plane, the extension length factor. We'll then compare to the opposite side. We'll preset with the transverse plane, drive overhead in the frontal plane, drive overhead with the frontal plane, and then with a little extension. And that's just kind of the cat's meow. This is some of my favorite right here. We will then go back to some left rotation. We're going to position and go after some type 1 in sync, rotation and side bend, opposite directions, but the rotation of the pelvis and the shoulder girdle in the same direction. I will preset the rotation first off of the lateral kind of aspect of the hip or off of the little toe or the heel, depending on the individual. Stance-wise, just a nice gentle little stance. We talked about not getting too far to start off, as if we take up too much slack from the bottom up, we're not going to get very much motion or have very effect in getting movement up and contribution throughout the segments of the back, nor is it going to be a really fair kind of evaluation and assessment. It's not going to significantly tell us a lot. That's very good truthful evidence. So let's preset with the left rotation. Let's drive with the right side bend. And so let's also go with the right side bend with the extension. And then we're going to go ahead and do the same thing, but switch in the other direction. So a little right rotation that's preset. We're going to drive with the left side bend and the extension overhead. In episode 1, we not only went after kind of the sagittal kind of extension and flexion type things in sync and out of sync. We'll do the same thing here, in that we'll preset with some flexion to get our type 1s as well. So what we'll do, if I wanted to go a little type 1 out of sync, so some of my patients that'll come in and, man, that L spine, those SI joints, things are just really ossified, a lot of ankylosis, kind of built up a lot of degenerative arthritic changes in those facet joints, and they're responding to really opening things up a lot. I'll use kind of this Troupling-like effect that'll feed down into the lumbar spine, which has a high affinity for the sagittal plane motion, by presetting with some transverse plane motion and some sagittal plane motion as I am preset in this flex position. But we don't have to go and go after just this significant change. We can slowly and kind of gradually make our way down, because again, it's motion rather than position. Although I'm in a flex position right here, I am also here as well, but the further down I go, I'm flexing the trunk and kind of those facet joints in the lumbar spine a little bit more. So I'll do my type 1 out of sync right here to see if maybe they're a little more successful kind of in the thoracic spine, and maybe I'll go down a little bit further and cross over kind of in sync right there. We'll then do the same thing over with our right rotation. So we'll go a right rotation type 1 out of sync, and so we'll kind of, based on the individual, kind of slowly just kind of make our way on down, see where they're successful, see how they're responding to that, see what kind of reaction we get to, because this isn't a cookie cutter like schematics that we're after. It's not going to tell us, hey, this is absolutely 100% how the individual is going to respond. That's where our skillfulness comes on into play to kind of tease this on out. And then let's also go with a little in sync. We go a little in sync with a flexion preset. And again, we'll go after kind of how we would go about statistically quantifying these little rascals as well. So with regards to some of these positions and some of these overhead like drivers that we're using, you're sometimes going to run into individuals, and maybe you're one of them, that based on maybe a shoulder pathology, or just simply for the fact that, hey, I'm not quite responding to that driver that way. We've got ways to modify all of our type 1 and our type 2 like things, and that we can always go like the song I'm a Little Teapot, hand kind of on the hip per se. So we can go hand on the hip, and we can use kind of the ear as a driver. I'll just say kind of, you know, tip me over and pour me out. I usually sing that. Usually patients, people don't like to hear me sing too long. It's not like I'm preparing for American Idol 2015. But I'll preset with the rotation. I'll use my hand kind of as the old driver there. But another unique way that we can go after kind of some of these things too, which I guess I should have noted in the type 2 autosync, we can always use a hand as a driver, slide it down a leg. But with our type 1s, again, in sync and autosync, another way that we can kind of comparatively speaking go after this to see how we respond due to the difference in drivers is, okay, let's preset this transverse plane, this left rotation. We know that type 1 is rotation and side bend opposite. It's like, well, what the heck, I'm used to going contralaterally with this load, and then my side bend kind of overhead. How the heck is that going to work? And is it possible? Yes and yes. So let's preset with our left rotation, and let's use our eyes and our nose and our belly button as kind of this positional kind of fixation and driver. Fix off to the left, and we're just going to side bend to the right. And so we can start just by, if we wanted to, just kind of slide down the calf and the leg of that lead leg. And we can kind of transition to even driving some rotation with the side bend from the old right side as well. And based on the height of the stick, we've got PVC pipes that are 6 to 7 feet tall. We can go a little bit higher even with kind of this rotational kind of driver, which then based on driving low will sequence into a frontal plane driver as well. So we actually get a frontal and a transverse plane driver from both sides, which I think is pretty doggone nifty. So right here, we could preset that rotation, and we could just start kind of side bending right here, and we can come right on inside immediately to that leg and drive our type 1 because we're preset with the rotation and we're driving our right side bend. We'll do the same thing over on the other side. We'll preset the right rotation. Nice gentle little stance. We'll get into lunges with all these guys in a while too, which just really shreds up the hips, man. So let's go with we'll preset a little right rotation. Type 1 out of sync, left arm. We'll side bend to the left. And then what I can do is kind of take up the slack a little bit more by with the left upper extremity rotating to the right and side bending to the left as I'm preset with right rotation, which turns into a left side bend as well, out of sync. And then the same thing right here, boom and boom. We can go a little bit more with the rotation and kind of the side bend. And from a musculoskeletal perspective, our roles as physical therapists, we need to know biomechanically when these pathologies and when these reproduction symptoms are occurring that, hey, is that person within our scope of practice to treat based on these symptoms that they're presenting with and the mechanics that they're using based on where their limitations are and where the root of the problem is. So those are our type 1 in sync and out of sync with our preset transverse plane kind of drivers, troupling, kind of the sagittal plane, the flexion, as well as the extension. Play around with those in episode 3 and 4. We're going to preset some frontal plane motion so that we can drive the transverse plane. Episode 4, we're going to put all this stuff together, start swinging both arms. It's going to get pretty dynamic, really interesting, and then I'm going to blow your Injinji socks right off of you with some closed kinetic chain, T-spine matrix progressive oscillation, activities, progressions, assessment tools, and treatment tools of stuff that is definitely 100% not out there, but that will rock your world. Play around with those guys, a little type 1 in sync and out of sync T-spine matrix with a preset transverse plane wooden dowel. Beat it up.